PSI, seen as safe. I'm going to instruct my partner to hold and maintain manual stabilization. I'm going to check circulation. Pulses are present. Can you wiggle your fingers? Can you squeeze my hands? Which finger am I touching?
Little one.
Which finger am I touching?
Second one.
All right. Pulses are present. Can you wiggle your toes? Which toe am I touching?
Big one.
Which toe am I touching?
Big one.
All right. Now my second partner is going to come help me log roll. I need you to place your hands on his hips and his legs. I will cross over on his hips and his arms. And on head's count, we are going to log roll towards me. Okay?
1, 2, 3.
I'm going to check the spine, the buttocks, and the backs of the legs. All right. On the C-spine's count, we're going to roll back.
1, 2, 3.
All right. I'm going to grab a hold of the patient's shoulders. My partner is going to grab hold of the hips, and we're going to move down on C-spine's count.
1, 2, 3.
We're going to move up on the C-spine's count.
1, 2, 3.
All right, thank you very much. Please continue to hold C-spine. I'm going to pad voids. Partner, would you mind patting the lower back? Squeeze my hands. Which finger am I touching?
The thumb.
Which finger am I touching?
Thumb.
Can you look at your toes? Which toe am I touching?
Big one.
Which toe am I touching? And I am done with the station.